The value of listening. I kind of alluded to this in one of the other talks. We really, truly need to listen. And we're going to spend just a little bit more time on the validation piece, because half of validation is not what comes out of your mouth. Half of validation is listening in the first place so you can figure out what's appropriate to come out of your mouth. So, validation versus reality orientation. People have, when they have dementia, perhaps a journey of anywhere from 2 to 20 years. Now, the average is 8 to 12, so about 10 years after diagnosis. Where they are on that continuum, on that journey, will make a little bit of difference as to whether you're going to correct somebody and bring them to our current knowledge base, or whether you're going to just go with the flow, join their journey, and try to connect instead of correcting. And that's the validation piece. Very, very early in the disease process, you might do some correcting. But I would encourage you, as the disease progresses, unless somebody is in danger of some nature, not to do the correcting. Do the listening. Let them tell their story as they see it. So validation means that really we're supporting that emotional meaning. We're not going to agree or disagree. We're going to explore. And this is a chance to ask questions. I've been saying, don't ask questions, right? Don't ask questions. This is a chance to ask questions. Tell me more. How did that feel for you? Did you like that? Whatever they're talking about, you can ask questions there. You really need to figure out what's on their mind before you can go on to any sort of distraction, which I mentioned earlier. Now, I'm going to show you 3 pictures here by a gentleman named Tom Hussey, and at the end there's his website. I think these are phenomenal. They're just a few pictures that I picked out from a multitude. But it's why communication sometimes goes off the rails. So when you look at this picture, I want to make sure I'm not blocking anybody's view. I want you to have a look at that picture. Phenomenal picture. So these are about the way people might see themselves when they have dementia. When they look in the mirror, they don't see somebody who needs an assistant. They don't see somebody who needs cueing, who needs to be told, brush your teeth. What does he see? He sees himself. He sees himself when he was in a younger career, when he was doing something else. So what we sometimes do is we forget when we look in the mirror and we see somebody who needs help, and we assume that our communication is going to make sense to them because they know the context of their situation. I think we're kind of not in the right ballpark. You can see in this picture, we have a senior, we have a nurse. Wait a minute, that senior had been a nurse. So when she looks in the mirror, she sees herself as the functional person. Who's this little upstart telling me that I'm supposed to be, using this walker or getting washed or brushing my hair or whatever it is? So we really need to remember that our reality and their reality do not always line up. Here's the last one. I just brought a few for you, but I thought they were so well done that it really speaks to us. So, gentleman who obviously was a firefighter in the past, there's his daughter trying to get him dressed, or maybe it's his wife. Maybe it's his wife trying to get him dressed. But wait a minute, why would I need you to tell me what to do, right? This is how I see myself. And that's why it's so important that we don't baby talk people, because they see themselves, no matter how the disease has diminished their physical capabilities, as fully functional, well people. No problem, nothing wrong with me. So how do we make conversation enjoyable? Because really it's about, having good moments, having good interactions with people. I've said don't correct, don't argue. Pick your battles. Really decide whether something's worth correcting and arguing over. Please avoid baby talk. Things like, oh, I've got your bib. Does your diaper need changing? Add a boy, add a girl. We hear people that think they're coaching and supporting people, but it's the kind of talk you might actually give your dog sometimes. So you want to avoid that. Scolding and raising your voice. It's pretty not effective for people with dementia. What they will pick up on is the upset of the moment, but they won't retain whatever the lecture was. They'll only know, ooh, things are wound up. When people have dementia, unfortunately, they tend to lose their abilities in approximately the same order that they gained their abilities when they were born. So it's kind of, if you have dementia, it's kind of like this huge bell curve. So when you're born, these are teachable moments. You can teach your 2-year-old, yes, after your bath, you put clothes on before you go downstairs. If somebody has dementia and for some reason they have forgotten to put their pants on when they come back out of the bathroom, that's not the moment to give them a big lecture about, you should be wearing your pants. They know, they've worn pants for the last 80 years. They got that. They wore them through school and for their career. That's the time that we're really gonna work on dignity preservation. So, oh, I know where your pants are, let's go get them. Just stay as cool as you can, as calm as you can, because using any sort of behavioral intervention when people have short-term memory, really not very effective. And then to be accepting of inappropriate answers and nonsense words. Kind of go with the flow as much as you can. And if you can't, well, we'll move on. I'm getting ahead of myself. Communication don'ts. These are a few things I'm going to recommend you try to avoid. Coming up behind somebody. If you have to come up from behind somebody, if there's any way to sort of circle around a bit, so you're at least coming in from the side, circle back and come in. Please don't argue with the person. Don't tell the person, you already asked me. It's not going to do any good, and it's going to upset both of you in the end. If they're asking you again, they're asking you again for a reason. The other thing is we often provide a lot of information at once to somebody because we can hold a lot of thoughts at once. They actually use the term bombardment. So it's one step at a time, one thought at a time, one instruction at a time. Avoid those pronouns. Don't always assume you're understood. If it's important, double check. Avoid that quizzing piece, and you only fill in the gaps if necessary. If you don't understand, if somebody is literally sounding like word salad, you just aren't getting what they say, try to look for cues. Look for their facial expression. Look if they're looking around or pointing at something. If worst comes to worst, ask them, can you show me? If they're still mobile, can you show me? Maybe they'll walk over and show you exactly what it's about. Be encouraging without doing the pat on the head piece. So you want to give positive feedback. And when you're having conversations, try to include the person. I have seen conversations where there's a couple. One has dementia, one doesn't have dementia, and there's a third person. And the only conversation that's happening is between the healthy person and the visitor, and the healthy person and the visitor, and the healthy person and the visitor. And at no point is the person, they're watching, but they're not involved in any way. So try to make sure that it's a triangle and not just an arrow back and forth. If you don't understand, you can say you don't understand. I always take it on myself. I always apologize and say, I didn't get that. Could you say it again? Or I'll take a best guess. You sound really upset, whatever it might be. And when it says be patient, that's for yourself as well as for the person with dementia. It's not easy on either side of the coin, so I encourage you to be patient. Choice is important, but limiting options. If somebody is more advanced in their dementia, 2 options. And if they can't handle 2 options, go to a yes or no. So it's like a funnel. You can take it down. Open-ended questions, how do you like your eggs? Usually not very effective as it progresses. Questions that give you the 2 choices, scrambled or fried are good, or do you want scrambled eggs? So it's a funnel, right? You can start large early, but as the disease progresses, you really narrow down. Ideas to avoid: shouting. Shouting, it won't help. Telling somebody they've already asked you something, being sarcastic or impatient, the correcting, the commanding, demanding, ordering. That's the piece where we might know what needs to be done, we might have a good view of the world situation, and the person's not on the same page as we are, and we really want them to see reality our way, so we start bossing them. You must do this, you have to do this. Anything that starts with a you must, you should, I want, those kind of commands and orders usually gets people's back up. Usually then they put the brakes to cooperation on. In general, we're certainly speaking to adults, and people need more processing time. If there's any way to invite, request, to avoid commanding, even if you need to help somebody, if somebody needs help putting their jacket on, and you say to them, put your arm in the sleeve, even if you're saying it nicely, or you're saying it with a please attached, please put your arm in the sleeve, it's still a command, right? It's still an order. So if there's any way when you're helping folks to think about switching it up and saying, would you help me put your arm in the sleeve? Takes it from a command to a team effort. And maybe they don't do much of the helping. Maybe they're putting in 1% and you're putting in 99% of that help. But it just takes it from a telling you what to do to an invitation. So think about, would you help me? Think about that way. Our nonverbal, you know that. We certainly communicate by emotion, expression, touch. Feelings remain, include the person. So the Alzheimer's KISS approach, that extra S for the extra TLC, is the keep it soft, simple, and slow. That's the best key that I can give you. Last but not least, I reminded you, the wet floor sign. I worked in long-term care for 30 years, and it's true. They see, now they have the little stick men, but I'm very old. So when I started, all our signs said wet floor on them, and the men would come along after dinner and they'd pee on the sign for you. And it just was, it said wet floor. What do you expect? I got it. I get it. So always listen for emotion. And remember that people can often articulate more than they, understand more than they can articulate. They often get more than they give back. And please don't talk about the person in front of them. That kind of goes without saying. So the person can't help their deficits. It's truly caused by an organic brain disease. It's a breakdown up there. So we have to change ourselves. One of the things that I've given is a handout called Communication. And I think this is a brilliant handout. It's several pages, but it's going to give you a lot of examples, how to be reassuring and positive, how to focus on the person's remaining abilities, how to meet them where they are and accept their current reality. What can I say? What can I do? So, great communication sheet. On the back is a list of a lot of other brochures. If you need more information, you can just be in touch with us and get those other brochures. And how do you know how to be in touch with us? Why, the beautiful gold brochure. This is the gold standard of communication. So I'm going to invite you to have a look at that, and on the back is all our contact information. And everything that we have is free for the asking, so if you'd like it, it's certainly there for you to have. So thank you so much for your attention this morning. Are there any questions before you race off to have your photo taken on the green at 10 o'clock? Because yay, Guelph, we're celebrating. It's the anniversary. Any questions at all? Well, I will be here for a few minutes. If you want to come and have a word, I'll certainly be here. Don't forget our services are free. They're affordable to everybody. And you can certainly be in touch with us. And I would look forward to speaking to you. So thank you and have a fabulous day, everyone.
Thank you so much, Robin. And on behalf of the University, we're going to give you a little token of our appreciation to the Alzheimer Society.
Thanks a lot, Annie. That's great.
Thank you so much.
We'll put that to good use.
And,
That's why our services are free.